Video of mine is about hepatitis D, which is also known as hepatitis delta virus. It's an infection that causes the liver to become inflamed. This swelling can impair liver function and cause long-term liver problems, including liver scarring and cancer. The condition is caused by the hepatitis D virus. You can simply call it as HDV. The virus is rare in the United States, but it's fairly common in South America, West Africa, Russia, Pacific Islands, Central Asia, and Mediterranean regions. HDV is one of many forms of hepatitis. There are other types of hepatitis on which I have already uploaded videos. There are actually 5 types of viral hepatitis: hepatitis A, B, C, D, and E. Till now, I have already posted videos about hepatitis A and B. You can see those videos which are available on my channel, and also I have posted a video about hepatitis C, and that is also available. Okay, and today I am going to talk about hepatitis D. Earlier I posted a short video about hepatitis D. I hope you have already seen that video, and today I am going to discuss this illness in detail. And after this video, I'll try my best to upload a video about hepatitis E as soon as possible on this channel. Okay, so now let's talk about hepatitis D. Well, unlike other forms of hepatitis D, it cannot be contracted on its own. So this point you should remember, because it can only infect people who are already infected with hepatitis B. Hepatitis D can be acute or chronic. Acute hepatitis D occurs suddenly and typically causes more severe symptoms. It may go away on its own. If the infection lasts for 6 months or longer, the condition is known as chronic hepatitis D. The long-term version of the infection develops gradually over time. The virus might be present in the body for several months before symptoms occur. As chronic hepatitis D progresses, the chances of complications increase. Many people with the condition eventually develop cirrhosis or severe scarring of the liver. There is currently no cure or vaccine for hepatitis D, but it can be prevented in people who are not already infected with hepatitis B. Treatment may also help prevent liver failure when the condition is detected early. And so now I'll tell you the symptoms. Basically, the symptoms are the same like hepatitis B. Okay, and sometimes it does not cause any symptoms. When symptoms do occur, these include yellowing of the skin and eyes, which is called jaundice, joint pain, abdominal pain, vomiting, loss of appetite, dark urine, and fatigue. The symptoms of hepatitis B and hepatitis D are similar, so it can be difficult to determine which disease is causing your symptoms. In some cases, hepatitis D can make the symptoms of hepatitis B worse. It can also cause symptoms in people who have hepatitis B but who have never had any symptoms. Now I'll tell you how it is contracted. Hepatitis D is caused by hepatitis delta virus. The infection is contagious and spreads through direct contact with the bodily fluids of an infected person. It can be transmitted through urine, vaginal fluid, semen, blood, and by birth. From mother to newborn, it can also spread. Once you have hepatitis B, you can infect others even before your symptoms appear. However, you can only contract hepatitis D if you already have hepatitis B. Now I'll tell you some risk factors. You are at increased risk of getting hepatitis B and D if you have hepatitis B, or a man who has sex with other men, often receive blood transfusion, use injectable or intravenous drugs such as heroin. And now I'll tell you the diagnosis. You should call your doctor right away if you have symptoms of hepatitis D. If you have symptoms of the disease without jaundice, your doctor may not suspect hepatitis. To make an accurate diagnosis, your doctor will perform a blood test that can detect hepatitis D antibodies in your blood. If antibodies are found, it means you have been exposed to the virus. Your doctor will also give you a liver function test if they suspect you have liver damage. This is a blood test that evaluates the health of your liver by measuring the levels of proteins, liver enzymes, and bilirubin in your blood. Results from the liver function test will show whether your liver is stressed or damaged. Now I'll tell you the treatment about hepatitis D. There are no known treatments for acute or chronic hepatitis D. Unlike other forms of hepatitis, current antiviral medication do not seem to be very effective in treating hepatitis D virus. You may be given large doses of a medication called interferon for up to 12 months. Interferon is a type of protein that may stop the virus from spreading and lead to a remission from the disease. However, even after treatment, people with hepatitis D can still test positive for the virus. This means that it is still important to use precautionary measures to prevent transmission. You should also remain proactive by watching for recurring symptoms. If you have cirrhosis or another type of liver damage, you may need a liver transplant. A liver transplant is a major surgical operation that involves removing the damaged liver and replacing it with a healthy liver from the donor. In cases where a liver transplant is needed, approximately 70% of people live 5 years or longer after the operation. Now I'll tell you something about long-term outlook for someone with hepatitis D. Hepatitis D is not curable. Early diagnosis is essential in preventing liver damage. You should call your doctor right away if you suspect you have hepatitis. When the condition goes untreated, complications are more likely to occur. These include cirrhosis, liver disease, and liver cancer. People with chronic hepatitis D are more likely to develop complications than those with acute versions of the infection. And now I'll tell you about some preventive measures. The only known way to prevent hepatitis D is to avoid infection with hepatitis B. You can take the preventive measures to reduce your risk for hepatitis B, and these preventive measures are: you should get vaccinated. There is a vaccine for hepatitis B that all children should receive. Adults who are at high risk for infection, such as those who use intravenous drugs, should also be vaccinated. The vaccination is usually given in a series of 3 injections over a period of 6 months. You should use protection. Always practice safer sex by using a condom with all of your sexual partners. You should never engage in unprotected sex unless you are certain your partner is not infected with hepatitis or any other sexually transmitted infection. You should avoid or stop using recreational drugs that can be injected, such as heroin or cocaine. If you are unable to stop using drugs, make sure to use a sterile needle each time you inject them. Never share needles with other people. Be cautious about tattoos and piercing. Go to a trustworthy shop whenever you get a piercing or tattoo. You should ask how the equipment is cleaned and make sure the employees use sterile needles. Well, this was my video about hepatitis D. One important thing you should always remember that hepatitis D cannot be transmitted on its own, and if somebody is already infected with hepatitis B, only that person can get hepatitis D. I hope you like this video. If you have any question about hepatitis D, or if you have any illness for which you want me to make a video, because there are so many videos about different illnesses on my channel. If you are suffering, or if your loved one is suffering from any illness for which you can't find the video on this channel, you can ask me in the comment section, and I'll try my best to make a video about your illness as soon as possible. Thanks for watching this video. See you in next video. Bye for now.